Okay, good morning everybody. It's a real pleasure to welcome you here to the Bridge House Hotel, and good morning to everybody that's watching us online. So if we could just take our seats and we'll get going. So Minister, ladies and gentlemen, you're so welcome here to Tullamore. Hopefully today is going to be quite a historic day in terms of the future of Irish healthcare. My name is Martin Curley. I'm a citizen of Ireland. I'm a professor in Maynooth. I'm chair of the Irish Digital Health Leadership Steering Group, and also I work at the HSE and Director of Digital Transformation. This is a conference convened by the Irish Digital Health Leadership Steering Group, which is a group of leaders from across society that have come together to try and drive progress with our health system. Health has become very important since COVID, and I think everybody acknowledges there's been a really strong response from the HSE. Has been very agile, very nimble, and very difficult circumstance. We probably actually face a bigger challenge here. A lot of the data, a lot of research shows that Ireland is a laggard in Europe. We're the 12th most prosperous country in the world. We're the 13th in terms of happiness, but we are number 80 in terms of healthcare. Our acute beds capacity is highest in Europe. We're running at 96%. In 2020 we were the lowest in Europe for telehealth, I think with Romania and Serbia, and I could give you many other indicators where we're lagging. But today isn't actually looking back, today is looking forward, and how actually are we going to transform ourselves from a laggard to a leader. We've positioned today really as an intellectual super collider, and we have brought together, and it is, Des O'Toole talks, the willing coalition, people that are really interested, that are professionals or patients, would actually see a higher goal and want to work together to transform our healthcare system. We know across the network there are really hard-working officials and doctors and nurses, but to transform, and the scale of the transformation that we need to accomplish is something that needs an all-of-Ireland approach. We have some fantastic speakers. I have to apologise in advance. Each of the speakers could and should talk for an hour, and they have that much content, but we've really compressed this. It is a super collider. We just want a lot of synapses firing going on and ideas hopping, and the networking is going to be really important. So we're going to try and move quickly through the day. We've asked the speakers to just leave one or two key messages that they would want the audience to take. We'd like at the end of the day to almost say have something like a Tullamore declaration. We've agreed with the chairman of the board, Sir Ciaran Devine, and Tim Hines, who's the board sponsor for the digital strategy, that we will compile a report and we'll present to the board in May. So this just isn't a conference, this is all about action. It's a working conference. We'll be doing a live transcription. We'll have a report with some key recommendations, probably 10 recommendations, which will circulate to you all and hopefully get approved. So without further ado, I'm so delighted to welcome Minister Eamonn Ryan, probably the most lateral thinking minister. I've had the privilege to know Eamonn. We played cricket together probably 35 years ago, but somebody who I hugely admire, somebody with conviction and courage, and was way ahead of the curve with the green agenda. And we've had the opportunity to talk in the last little while, and Minister Ryan will talk about health as being one of the top key challenges for the government. So please give a very warm Midlands welcome to Minister Eamonn Ryan.
Good morning, Martin. Good morning, everyone. It's rose-tinted glasses you're looking through because it was 45 years ago, Martin. And I played cricket not just with Martin, but Martin's dad, Brendan. Fond memories. But also through the years, I'm really glad to be here, because through the years, myself and Martin keep bumping into each other and keeping in touch. And I think some of the work you've been doing, Martin, in terms of how we innovate, how we manage change as a country, is of real importance and potentially huge benefit for the people of this country. Innovation 2.0, I think, wasn't it? I remember a conference you held in the height of the crisis. I remember back, it was from 2011 or 12? 2013. My memory of dates is not great. But I thought for me it was one of the most interesting projects which encapsulated a real truth. That in this evolving, developing world, mad world we're in, collaboration and connection and working in an open, sharing way is what's going to bring success. And that, I think, was the term, the quadruple helix you mentioned, of government, academia, industry, civil society working together in a collective way is what is going to deliver the new services in this world where we're seeing a digital technological revolution, clean energy revolution, transport revolutions. They're all happening at speed, and they're all connected. But also what we need to see is a health revolution, and using these technologies to bring a huge increase and improvement in the quality of our health service, in the outcomes, and also the experience for everyone working within the system. As if by magic of walking in the door here, that example of bringing people together, who did I meet but Fraser McKim, former neighbour of mine, who's a really good example of people in industry who are innovating with all the latest new digital telecommunications technologies. I hardly turned around, but I bumped into Philip Nolan, the head of Science Foundation Ireland, who I think has a critical job now in bringing this innovation approach to our research capability and applied research, in my mind, in terms of how we will best learn and develop our scientific capability and understanding. And then I hardly turned left, and I had the great privilege of meeting for the first time Professor Kerstin, the head of University of Limerick. And I said, well, there's a great example where you can start meeting in this room, as I said, in that networking way, the variety of different resources we have in this country that we need to bring together to deliver a real radical change in how our health system works. Very briefly, it was with Philip at an event late last week, our National Climate Dialogue, and Peter Lunds from the ESRI was speaking at it. And we were speaking about climate, but he interestingly referred to a major research project that they had, a behavioural research and project that they've been engaged in recently, assessing what really interests the Irish people. I won't surprise everyone in this room or elsewhere. The three key issues that came up were health, housing, and climate. It was in the top three. And speaking for the government here, it's similar that there's a very similar, clear direction within our work, that it's those three challenges which are the centre of everything that we have to do. That there is a real requirement for us to start innovating and take some of what we saw in COVID, that ability to be agile and into very difficult circumstances, to change the way we do things, to deliver better outcomes for patients, to deliver better outcomes for the staff working with the health system. Same in housing, we're going to have to be incredibly fast, and the scale of change in climate connected to the energy security crisis brought on by this war in Ukraine. All three, we have to deliver huge change very quickly. And in all three, I would argue that the basic building blocks are in place. The basic policy directions are set and clear. Be that in our Housing for All strategy, be it in the climate action plan we have, or in health, the Sláinte Clare plan, and the regional development, regional hospital and other structures plans. The key plans are in place. The question is, can we deliver real and effective change? And that's why when Martin approached me recently in his new role, in this digital transformation role within our health system, I was particularly interested. Because we have shown in government, our government has shown, we've been able to increase the health budget very dramatically to respond to the COVID crisis. But we're not going to be able to forever and a day just look at solving health problems just on a budget expansion, resource expansion approach. we do have to get the best value and get the outcomes for this funding and what we are spending. And I think, without being critical of anyone here in the room or anyone with the responsibilities in the area, I think there is a clear and honest assessment that in terms of the adaptation and the using the benefits from the digital technologies as they're evolving, we haven't in this country acted fast enough or been ambitious enough or seen enough deployment. This now, all the plans, launching other plans, we now need, and we've very good kind of digital aspirations, but now we need to turn it into reality. We make it real, a real effective change. Just one or two thoughts, Martin, you were saying, gave us the challenge just to leave everyone here with one or two thoughts. I want to come maybe with my perspective to throw into this as Communications Minister. Cover a few different titles: environment, climate, transport, but also communications. And I want to just very briefly share, if I can, maybe what forms some of the discussions here today, some of the thinking, my own thinking going back 10 or 15 years about what best accelerates digital transformation and the application of new digital technological solutions to meet our everyday needs. And of course we need, and my side of the communications policy, digital policy, is very much focused on the network side. So our department is responsible for delivering the National Broadband Plan, for getting the whole cyber security. God knows we know in the health system how important that is. It's very much on the physical side of how we provide networks and secure systems for our various housing, health and other services to be able to deliver. And that is important. We need to get that right. The National Broadband Plan is working. It's not as it takes time to, often we're down in the street and in the ducts to actually get all the fibre through, but we will deliver it. And actually there's a wider story in terms of the rollout of fibre network in our towns and cities as well, which is now really advancing. We are actually stepping right up the European league table in terms of households with fast broadband connections and businesses. So we will, within the 4 to 5 year time frame, have pretty much ubiquitous high-speed internet connectivity capability. And we also significantly resourcing our cyber security side to try and make sure that's a secure network. So all that work is progressing. It's really important we deliver on it. But I would argue it's not the key metric. So it's one key metric, but it's not the only key metric in terms of how do we get success in the rollout of the technology, of this digital revolution we need to see taking place. I think if I was to say what's the other key metric, it's around the ethics and the trust, the public trust and buy-in to what we're trying to do. All the technology, all the smartphones, all the other kind of network capability will be to no avail if we don't get the underlying principles right around, in my mind, the ethics and values and culture of how we use these networks, how we share data, how we manage to use this data in a really clever and flexible way. And I came to some of that thinking as a policymaker. This is one of the toughest policy areas because, for example, we've seen huge benefits in terms of the social media networks we've been developed, but actually huge downsides and loss of confidence and loss of trust because a business model led by certain algorithms has pushed a more polarizing system. The underlying understanding this ethical framework is really challenging because you have competing principles in many cases. You have a principle, let's say, of transparency, sharing of data, open access. But at the same time, you also have a principle of privacy, protecting people's data and the whole ownership of it. There's a principle, is the fair use principle, I think, isn't it, they call it in the States, where you can take other people's innovation and you add to it. But then at the same time, you want to pay content creators. So there's a whole often variety, sometimes competing principles that you have to make trade-offs. So we have to assess how do we get the right spot there for setting the ethics and values and principles that we want to adhere to. For policymakers, this is particularly difficult, not only for that conflicting principle sometimes, but also then you have to take into account the reality of what the networks are actually doing. You think you can regulate mobile or internet systems, and you realise very quickly that it's so complex and so hard sometimes in a global internet system to be able to actually regulate it. So you need to understand the norms, what's actually happening with the technology before you get down to the policy decisions. So I just think today, and sorry if this is a very broad and simple kind of perspective, but I imagine one of the interesting things that you're going to be discussing, that this networking and colliding event, as you call it, Martin, is how can we as a society, and this is a societal issue for all our people, all our institutions, the government, research and other institutions, but this will work best when we get the ethics of the sharing of the data and the use of the data right, so that we maintain public trust in what we're going to need to do. And that surely is needed in healthcare more than any area. We need it in climate, we need it in transport, we need it in other systems. But the fundamental underlying requirement in health, I would imagine, is that sense of patient confidence, patient trust, patient buy-in to what we're going to use these technologies for. And I think we've certain advantages in this country. As slow and as behind the curve where we have been to date in the application of digital solutions, we do have, in our democratic constitutional republic, high levels of trust in a world where trust is not easily gained. And we've made failings. One of the reasons you develop trust is where it doesn't exist, we should raise it, focus into how we can restore it. But the deployment of vaccines, Philip, you and others, the work was done there was an example to show that we can actually develop a culture of common trust in our health system solutions. The way our health system works, this broad public and political agreement around this launch care approach. There's broad consensus and trust that yes, we do want to go towards a more distributed, in the community, avoiding hospitalisation wherever we can. There's broad trust in the political public system that this is the way to go. So, and I think because we have certain characteristic as a small country, that there can be trust in terms of people in the room here can meet each other, can exchange information, can agree to work in collaboration together. Basic collaboration has to be that sense of trust that we're working together to benefit both or all the different sides. So, sorry if that's very general or quite abstract, but I think it's actually key. And certainly from my side, as Minister of Communications, we're really keen to work with you, to continue to work with you, Martin. I know I'm sure the Department of Health and others are saying the same. But from my mind, some of the work you're doing here and the proposals that have been presented in terms of deployment, remote censoring and other stay left, shift left concept is exactly the right one for some of the innovation we need now in our health system coming out of COVID, using that sort of innovative spirit we developed in COVID not to stop and to really run that into this digital transformation in health as a key part of what we need to do next to answer that very common and clear message from the Irish people, from Peter Lund's analysis, that they want this innovation, they want to see the improvement in our health system, that some of these solutions you're presenting today, Martin, can do. So thank you for your work. We look forward to working to collaborating as one government department with some skin in this game on the communication side. We look forward to working with everyone in this room to make it happen. And as I said, the key thing is, and I'm very interested, the President of UL, we were just chatting briefly beforehand, your that sort of academic knowledge and interest in this subject, based on ethics and values and principles, is going to be the key to make it work. Thank you.
Thank you very much, Minister. COVID has actually hit a number of our speakers, so apologies from Minister Donnelly, and we've a few other keynote speakers that haven't been able to make it. I think what we'll do at this stage, Conor, if we could cue up the message from the HSE Chairman, Sir Ciaran Devine, and we listen to that, and then we'll actually really get into the meat of the conference. So, Conor, if you can bring that up, please.
Actually, we understand that it is now nearly 7 years since the Medicines Optimisation Innovation Centre was launched here in Northern Ireland. And over those years, the centre has had much success and many notable achievements through its dedication to deliver better health outcomes for the people of Northern Ireland. And those working in the Medicines Optimisation Innovation Centre have been carrying out cutting-edge, excellent and dynamic work, enhancing its reputation on a UK, a European and worldwide basis. The appropriate, safe and efficient use of medicines is an important enabler of transformation within our health service here in Northern Ireland, supporting improved patient health outcomes and reducing pressure on services. So ensure that medicines are used safely is a challenge that is shared by countries right around the world. Indeed, the World Health Organization has recognised that unsafe medication practices and medication errors are actually a leading cause of avoidable harm in healthcare systems across the world. So during my time as Health Minister for Northern Ireland, I've been proud to launch the Transformation Medication Safety in Northern Ireland, which sets out our approach over the coming years to tackling some of our known wicked problems within medicine usage. Our new approach to medication safety builds on the Department's Medicines Optimisation Quality Framework, which adopts a regional evidence-based approach to care. And that framework sets out the standard for care that people can expect when medicines are considered an important part of their care, with delivery supported by the Medicines Optimisation Innovation Centre, as well as being a vital enabler of delivering transformational change in the use of medicines in Northern Ireland. The Centre has over the years continued to build links with many different countries, and that's both to share innovative best practice pioneered here in Northern Ireland and to bring back learning from elsewhere, bring that back to our health service for the benefit of our people. I want to commend the work of Professor Scott and his team in raising the profile of Northern Ireland in this area. With our ageing population, it has become even more critical for European countries to work together in a focused way to manage and prevent inappropriate polypharmacy and improve medicines adherence through the use of a change management approach that is coordinated and collaborative in order to deliver better patient outcomes. This MOU will build on the existing collaborations that MOIC has built throughout Europe and deliver on one of its key objectives to share learning. This collaboration will enable joint working towards common goals and look at innovative ways technology can be used to enhance healthcare within our region. The MOU also offers the opportunity to explore the potential benefits of researching and co-innovating digital health solutions, whilst also building a culture of partnership and collaboration between the health service in Northern Ireland and the Republic of Ireland, as well as the private sector, and that's to be welcomed. I continue to be fully supportive of all the important work that is being done on medicines optimisation, not only in Northern Ireland but across Europe and across the world, and I wish you all continued success with this.
Thank you very much, Minister Swan, and at lunchtime we'll be signing an MOU with MOIC and Professor Mike Scott, and we're talking about this isn't just a Republic of Ireland approach, but it is an all of Ireland approach. We're not, that clearly wasn't Sir Ciaran Devine, but we are now going to hear from the HSE Chairman.
We're at the cusp of a dramatic leap forward for the Irish health system. For the first time, we've got the whole health ecosystem, clinicians, patients, HSE, academics, state agencies, all aligned behind this idea of stay left, shift left. Stay left, shift left is extremely aligned with the ideas and principles of Sláinte Care, the HSE corporate plan, and the programme of government. It's about keeping people well and out of hospital. And if you happen to need a hospital, it's about getting you home as quickly as possible. Digital technologies will allow 10 times the performance improvements and benefits. And today we will have many, many examples of improvements of orders of magnitude in terms of performance. I'm happy to see people supporting this from across that ecosystem, whether it's the Department for Enterprise and the Department for Transport, providers such as Microsoft, Eposi, Roche, Medtronic, the IDA, Enterprise Ireland, Science Foundation Ireland, HICWA, and many, many others. And I also want to thank Professor Martin Curley and his team for pulling all of this together and for bringing all the partners we need to make a real transformation in health and care in Ireland to the table. So myself and the HSE board are right behind this initiative and want it to go as quickly as possible. Thank you very much.
Great, thank you, Chair. So I'm going to quickly go through some introductory slides, and we have some fabulous speakers lined up. This will be a drive-by shooting of our strategy, so pay attention and watch carefully. Stay left, shift left is a very simple message, as the chairman said, keeping well people well at home and doing as much care at home. We have, as I said, an acute hospital crisis. You cannot run a system at 96% capacity, but the idea of hospital at home actually is a really attractive solution. We now have the technologies in place to do that. A theme of the conference is seeing is believing, so we're going to get almost immediately into demos. But what are the key messages? We want to leapfrog to be a European digital health leader. Stay left, shift left as a very simple message for actually every investment we make isn't allowing us to stay left and shift left. 10x is digital technologies with an exponential mindset can allow us to leap forward and do things that frankly 2 or 3 years ago we couldn't have imagined. Minister Ryan talked about Open Innovation 2.0. It's a bleeding edge innovation methodology, but at the highest level it's actually very simple. Minister Ryan mentioned trust. There's a lot of trust in this room. Carl Eric's Spivey said trust is the bandwidth of communication. Intensive networking, and we're going to see an example that John Sheehan will share later on today, where in 2 weeks some world-class innovation was put together. It's about shared vision, stay left, shift left, and then lastly it's about shared value. So we talk about well-being, welfare and wealth. So thinking about health no longer as a cost, but as an investment. So that I think is a key paradigm change. This is an all of Ireland approach, and it's fantastic to have Minister Robin Swan speak about the MOU that we're going to sign. And then it's a let's do it culture. So Obama said, yes we can, we're saying let's do it. So in 4 slides here I want to tell you the story. Healthcare is a decade behind on digitalization compared to sort of music, retail, banking, but it's actually catching up fast. But amongst that cohort, Ireland is way behind. We're 4th last in electronic health record maturity. And despite having a strategy for more than a decade to put electronic health records into hospitals, we have failed. A couple of exceptions. Professor Richard Green did an amazing job getting a system into Cork University Maternity Hospital and to other hospitals, but we haven't been able to progress from there. We have all these amazing technologies, probably uniquely in time. We have 4 or 5, 6, 7 disruptive technologies all showing up at the same time. So this is actually allowing a perfect storm, and we have to harness this and ride the wave. Our goal is to leapfrog from a system where it's patient-based, it's presence-based, and you have to show up at the hospital, to one which is patient-centered, which is cloud-based, it's an individual personal health record, and we're actually going to introduce a personal electronic health record. We currently have 20 citizens actually trialing this, but we think we could provide an electronic health record, a personal record, to every citizen in the country for less than the price of a nice latte at Starbucks. When we originally talked about electronic health records, there was an €800 million budget planned for it. But we can do this for a handful of millions. The only thing that's stopping us is the courage and the conviction and the culture to actually do it. So as I said, at the end of this conference, we're going to pull together 10 recommendations, and one of those certainly will be to accelerate a personal electronic health record nationwide. We're working with Maynooth University and 4, 5, 6 companies. We're going to hear about this later on. Digital Health and Wellness Capability Maturity Framework, and Professor Philip Nolan, when he was president of Maynooth, was actually the chair of the Innovation Value Institute, where we pioneered the approach of these kind of models to enterprise IT we're now taking it into digital health and wellness, and we're actually measuring and actually guiding our progress. And there's a lot of interest on this globally. In 2 weeks we have the opportunity, Professor Elizabeth Teisberg and Professor Michael Porter have written the famous book Value-Based Healthcare. We're working directly with Elizabeth and her team. We'll be presenting the first results of this in Barcelona. So stay left, shift left. It's all about moving left on this curve. All the time we're looking for 4 benefits, and what we're finding is because of the exponential nature of digital technology, and if we can apply an exponential mindset, we're more and more seeing 4 kind of benefits: better care, better outcomes, lower cost, better value, better quality of life, better patient and clinician experience. And here's an example of some of the companies that we're working with, and we're walking the talk. Most of our investments are in the stay left space, so 70% of our portfolio is about driving care at home. But I did want to mention in particular one innovation that we're introducing. Dr. Mike O'Connor, who's our NCACO for acute, is the direct sponsor of this. It's a small Galway company that is going to transform how we do patient care in our wards. We will detect deteriorating patients earlier, and less of them will die, less of them will go into ICU. But the massive win from this is we'll have shorter average length of stays, but we can directly actually translate that into improved acute capacity. So just to do the numbers, the data to Syncify are seeing in Scotland, where this is deployed, is average length of stay reductions between 15 to 20, 25%. If we were just able to translate that into a 5% increase in capacity, that would give us actually a new acute hospital with 500 beds at way less than 1/100th of the cost. So here's a real digital advantage. We're thinking about building hospitals, and we'll hear from Jimmy Sheehan, the founder of the Blackrock Clinic, some of his thoughts on that. But right now, we should be ploughing money into digital vital signs automation. We save lives, shorter stays, but we build capacity. And this is something we actually have the evidence, and again, it requires just the courage and the conviction to do it. We're going to hear briefly from Richard Jones, President of C2AI, on his thoughts on stay left, shift left.
Hi, my name is Richard Jones. I'm the Chief Strategy Officer for C2AI, and we're working with HSC on elective recovery in terms of prioritising the waiting list to reduce emergency admissions by 8% and to free up to 15% of capacity through better selection of patients. What I'm here to talk about is stay left, shift left. We expressed this view directly to the team a few weeks back. One of the things that is so powerful about this is that in a world where everybody in theory should be trying to help hospitals save money, save lives, make people better, not make them worse, actually what we see in terms of policy initiatives are incredibly complex. And what's wonderful about stay left, shift left is A, that it's a superbly simple but enormously powerful concept, but also just encapsulating it in 4 words means that you can share that with somebody and they can get grasp of it very quickly. And we should say that in stuff we do around the world with regulators, with other systems, actually that message doesn't get across clearly at all. So one of the nice things about this is that you can understand if you're doing something consistent with stay left, shift left, and if you're not, so we really should question as to what the value of that is. And I suspect a bit like with see it, say it, sorted, this is a phrase which is going to travel around the world. So congratulations, it's a really good programme, and it's also a really smart way of being able to maximise the sharing of that message. Good luck with the conference. Thanks very much.
Thanks, Richard. And we worked with the UK government, who have a first 100 company portfolio. We ran an assessment exercise of the top 10 companies using the stay left, shift left criteria, and actually Richard's company C2AI came out as the number 1. We also have Mohammed from Patients Know Best, who came out number 2. But I'm delighted to say we're working with Katrina MacDonald and the hospital here in Tullamore to use this approach to actually reduce waiting lists and improve outcomes. We've had a digital transformation strategy for about 2 years. It's about informing and educating, and thrilled to have the partnership with Professor Kerstin May, who will talk about what we've been doing with the Masters. We've been igniting the ecosystem. This is an example of the activity. We've had 7, 8, 9 Digital Academy forums, and we have about 50 original pieces of thought leadership from around the world that are available online. We have a whole open innovation process and way of prioritizing ideas. Core to what we're doing is the idea of living labs. We have 50 living labs across the country, and then we're implementing. The average success rate of digital transformation is less than 30%. Using the living lab approach, going from proof of concept to demonstrator, we have an 80% success rate, which is unheard of. But going from demonstrator to broad adoption, we currently have a 100% success rate. So we manage using an innovation pipeline. When I was at Intel, we had 19 different innovation pipelines. In the HSE, we only have one, and this makes innovating very efficient and very effective. We have labs across the country. You mightn't expect it, but Letterkenny is a hotbed for emergency general surgery and the use of AI. And Michael Sugar will be talking about that. Des O'Toole, our design thinking lead, is working with Vera Keatings and Antoinette Doherty, and a technology you'll see a little bit later on with Miles Murray from Respirosens is now out in the community. It's all about agile. Let's do it. When COVID came on our shores, Eamonn Costello from Patient Empower came into me on the Monday that COVID showed up. By Tuesday, we were demonstrating a product live at the IIEA, and by Friday, it was being prescribed from St. James's and Mater. So a week from concept to solution, and it was across 30 hospitals in 5 weeks. This is the technology. Respirosens, again, the first weekend COVID was here. Miles, Lorraine Smith, and myself were with Professor Richard Costello, one of the most eminent clinicians in the country, and we're delighted that Richard is actually going to do our closing address. But this is now in 23 hospitals across the country, and we've leapfrogged from being an absolute laggard to a leader. I'm going to ask, can anybody guess what the average error rate on nurse-read respiration rates is when we examined it in Beaumont Hospital? Can anybody guess? And this is not because they're bad nurses. It's very difficult to measure, but it's 80%. So we've now introduced a technology that's much easier and actually gives us 100% accuracy. So we're now in a world-leading space. Open innovation, the minister referred to this. This is about everybody innovating together. High trust, high networking, shared vision, shared value. And these are just some of the companies in the network and our ecosystem. And the ecosystem has trebled in the last year. So we're now going to run a message, because we are getting a lot of help globally. People are lining up with us, and we can run the video from Dave DeAngelis, please.
Hi, this is Dave DeAngelis with Dell Technologies. I'm the Healthcare General Manager. And the motive of today is re-imaging healthcare. And boy, is that in line what we have done from a United Nations General Assembly perspective, and what Martin Curley has built around stay left, shift left, that idea of driving wellness and incorporating that ability for men and women just to stay healthy, right? To stay ahead of the curve, to stay in front of those debilitating diseases. And then when I think about where we are in the convergence of the technology at the edge, that point of care, and where we are emerging in the white space between episodes that we can bring together, and we can do that with the launching of the HSE Innovation Center in Ireland. And you look at what Dell is doing with our Healthcare Innovation Center that we're launching in Austin later this year with Dell Children's Medical Center. Boy, those are things coming to alignment, and boy, can we make a difference. So my challenge again to everyone on this call is, don't be a bystander. Join with this group that Martin Curley has built with this United Nations General Assembly, and this group of all across the globe. Lean in with us together to help our population stay left and keep running. Thank you.
Great, thank you very much, Dave. One of our key principles is actually 50% of success is showing up. Thank you all for showing up, and as David has asked, please lean in. There was a big award ceremony last night in the Shelbourne Hotel. We had a late night. Conor McGinn, let's do this. Conor approached me again the first week of COVID, came into Dr. Stevens and said, look, I have an idea, we could use robotics and ultraviolet light to kill COVID and lots of other nasty stuff. I said, great, Conor, can you bring me a prototype? 2 days later, he showed up with a taxi and he took Violet out, and Peter Colm Henry and Dr. Stevens was really taken by this. But this has now moved on, and this isn't Sloan Kettering in New York. This is actually a mile up the road It is in the Midland Regional Hospital, and Connor's technology is running there, and what we find is it's 5 to 10 times faster cleaning than humans. It is 3 times better. It's also 2.5 times cheaper. But the beauty of this is actually being designed with the cleaning team. Connor actually spent several weeks working with the cleaning team to figure out how could we co-design this. And I'm delighted that Connor and his team won the best pilot project in the country last night. So congratulations, Connor. And you'll be able to see that outside. So here's another technology. This is Dr. Roisin Malloy, and everywhere she shows up, she collects an award, and we were jointly privileged to receive the Sustainability Award from Health Tech Ireland a couple of weeks ago. But Roisin's innovation is very simple, but very technically savvy. An infrared non-contact thermometer that improves nursing productivity, eliminates 80% of HCIIs actually come from contact, and this eliminates contact, and so 5 times lower TCO, 5 times faster for nurses, and we'll hear from Roisin later on. But also delighted to say that Roisin and her team picked up another award last night for another sustainability award. So congratulations, Roisin. We're going to hear from Ross and Centric Health. The Minister talked about the network. Where we're moving to is network-centric healthcare, and we're delighted to have the Centric Healthcare team here. And we also have John Carl, the CEO of Navi Care Plus, the biggest pharmacy network in the country. And both of these, Moss Cox unfortunately has COVID and can't be here today, sends us apologies, but these two companies are pioneering, and we're going to show in our showcase something that we pulled together very quickly with Care Plus, with Google, with AWS, with Full Health Medical, so stay tuned for that. We're going to hear about vital signs automation. We're going to hear from Ryle Jensen, who's the CEO of our equivalent organisation in New Zealand. Paul Reid, when we announced this programme, said we need to work with the best and the brightest. New Zealand are forging ahead, very similar population to our own country, and we're collaborating closely with Ryle. So a very short message from Ryle, and then I want to get straight into a demo, and then we'll get into the next speaker.
Tēnā koutou katoa, ko Ryle Jensen te koinua. My name is Ryle Jensen, CEO of the Digital Health Association New Zealand. We are collaborating with Martin Curley and his HSE Digital Transformation team on the Irish National Digital Health Strategy. Stay left, shift left. I look forward to leaping ahead together in digital health. We can collaborate and help each other. Ka kite anō.
Right, thank you very much, Ryle. So the subtheme this conference is seeing is believing. So if we could put my vital signs up. I'm wearing a device on my arm. It's from a Scottish company. It's called Waire. It's like a credit card. And Connor, if you can go to that in London. So this is reading my vital signs in real time, and hopefully we'll be able to see my pulse rate, which will probably be very fast. I have tachycardia. Are we able to see that, Connor?
I'm Martin. I'm unable to share my screen.
Oh gosh. Okay. Well, can you work on fixing that, Ved, and we'll come back to you in 30 seconds.
Monica needs to just allow it.
Okay, great. We'll come back to you. I'm also wearing an Irish device called PanPan, and we're going to demonstrate this just after the break. But this actually, I jumped up on the screen aggressively, and actually the tonsil centre in Bunclody detected that as a fall. You might have heard, and they actually came into me 20 seconds afterwards. Martin, we've noticed your fall and you need help. So we're going to demonstrate that in real time. We'll come back to the Waire demo in a second. We have put governance in place. If we're going to be successful, you not only need a strategy, you need governance, you need an architecture. There is no architecture for building a national digital health system, and Des has given me the 1-minute warning. Well, we are actually building this, and we've been able to successfully link suppliers or players like PMD, Patient Empower, Synchrify, TriMedica, SwiftQ. So we've actually built an emergent architecture, and we hope, based on the enterprise agenda, that we can actually sell this solution globally. So Monica, can I check if we are able to go to VED in London?
Yeah.
Great. Connor, can you display that, please?
Okay. Tell me if you can see
We
this
actually
now.
can't see you. We did rehearse this yesterday, twice.
Just a second. Tell me if you can see this now.
No, yes, okay, thanks. So VED is based in London, and we're working with TCS. Just an advertisement, May 18th, we have the Q2 Digital Academy Forum in Letterkenny. We're going to be making an announcement with TCS and the Letterkenny University Hospital on some specific collaboration. VED, we can see your screen, but have you logged in? So
Can you see my screen still?
the site can't be reached. We can see your screen, but you don't seem to have access.
I'll just switch browsers, Martin. What I'm going to show you in a second is your vital sign that I can see actually on my screen, but for some reason it won't come up here. But
can we reload there?
yes, I'm just doing that.
So one of the most important things for digital, with so much potential, you need what we call dial tone. It has to work every time. Every time you pick up a phone, it works. Unfortunately, IT in hospitals and at home doesn't work every time. Okay, so great. So we can see this VED. So if you could just click on me, I'm one of the patients being remotely monitored. Anybody guess what my pulse rate will be? Oh, so it's 100. So Professor Nolan, is that officially tachycardia or it is? You can see my breathing rate is, respiratory is up, my core temperature is being recorded. So what can you tell VED from this?
So it's really interesting, Martin, because obviously, apart from what you just called out, we can actually look at the variation of your average heart rate over the past few periods.
Hopefully not at 3 a.m. this morning.
No, these are daily averages. And so we can also look at alerts. So if there has been any specific issue that should have been tracked, it would have come up in the alerts activity here. So if your temperature went beyond a certain area, and of course, we can do this we can also look at, what your levels of motion are. And should you have, and some of this data, obviously, we've just, looked at it because you haven't really had a fall, but if you had a fall, this would show up here in terms of your motion and capabilities. And we can also obviously check if the device is actually working, and even though the reading quality isn't great, all this data is coming through, which is excellent.
Fantastic. So VED, I think this is absolutely the future. So hospital home is very real, and we're working with Microsoft and TCS, so using Microsoft Cognitive Services, so we can predictively predict, if somebody's going to deteriorate. So I'm going to close there. We're going to run the video from Dr. Orlaigh Quinn, the Secretary General of the Department or DETI. I think the Minister has got to leave, but we very much appreciate you being with us, and 50% of success is showing up. So thanks for showing up, Minister, and enjoy the rest of the day. So we'll hear from Orlaigh, and then we have Dr. Mike O'Connor, who's one of our leading clinicians. I think is going to give us a really compelling keynote. And when Mike and I met, there was a connection in 30 seconds, and he immediately got what we're trying to do is now actually turbocharging our efforts. So Connor, can you run that, please?
Hi everyone. I'm delighted to have the opportunity to be with you today to attend this digital health conference, Stay Left, Shift Left. This is a time when the whole of government is looking at how we can take advantage of new technologies for the benefits of citizens and society. Just last month, the government launched a new national digital strategy called Harnessing Digital, the Digital Ireland Framework. This strategy involves a number of government departments, and it's being led by the Taoiseach, Leo Varadkar, and supported by my department. E-health is a big focus of the strategy and a key part of our ambition to digitalise public services. This is an area where we see great potential for innovation and reform. It includes developing solutions in electronic health records, e-prescriptions, as well as telemedicine and remote care monitoring. Within the specific sphere of health, I believe this is a pivotal moment in the future of healthcare in Ireland. For the first time, we have a health strategy which spans and is supported by everyone in Irish society: government, industry, academia, and most importantly, the patients and citizens that we all serve. Not only that, it is a strategy that supports health, enterprise, and sustainability goals. The goal of the strategy is ambitious, but I believe very achievable. The plan is to leapfrog from a health system that's primarily paper, presence, clinical, and acute centred to one which is patient, community, and digital based. Our plan is to move from being a European digital health laggard to a European digital health leader by 2025, a great ambition. I'm very pleased to see the involvement and support of key agencies under my own department's remit, such as Enterprise Ireland and the IDA, with support coming from the very top of those organisations. The key to this digital health transformation strategy is the use of a new model, Open Innovation 2.0, which indeed Martin has led on. I also have been a main sponsor for innovation strategies and initiatives, leading civil service renewal, public sector reform in my previous role as Head of Reform in the Department of Public Expenditure and Reform. More recently, I've led on Innovation 2020, which is our enterprise innovation strategy, and indeed our public sector 2020 plan for innovation. I really want to commend the HSE digital transformation team, led by Martin, as being a role model and an exemplar of the type of innovation leadership we want to see right across the public service. I'm delighted that there has been such a fertile collaboration between Enterprise Ireland and the HSE digital transformation team, and multiple Indigenous Irish companies involved, such as Patient Empower, PMD Solutions, Synchrofy, SwiftQ, RedZinc, MMD, and all being awarded large contracts following successful progression through the HSE Living Labs process. We know that not only are Irish citizens and patients achieving better health, but we are now becoming a reference site for international sales. And we see this in the collaboration with the IDA and many multinationals such as Microsoft, Medtronic, Roche, Cisco, Dell, Huawei, Merck, and many others working with the HSE digital transformation team. The organisation and the personal commitment of the two CEOs, Leo Clancy for EI and Martin Shannon for IDA, is matched by my own team here in the Department of Enterprise, Trade and Employment. By working together, we can all look forward to a healthier future for Irish citizens and a rapidly expanding contribution from the digital health sector to national GDP and economic growth. I hope today I've set out some of our thoughts, government policies, and it will be helpful to you in your deliberations. Thank you, and I wish you every success in your conference.
Great, thanks Dr. Quinn, and Dr. Quinn has been a tremendous sponsor for innovation in the country. So our next speaker is Mike O'Connor. He's the NCAGL for acute. I was talking to Mike 2 days ago and said I have many demands on my time. I said, Mike, if I have to come down to Cork to bring it to Tullamore, you're going to show up, and I'm so delighted he's here. I think you're going to really enjoy it, and I think the future of health, when you hear from speakers like Mike O'Connor in Ireland, is in safe hands. So please welcome Dr. Mike O'Connor.
Very much. I have a bit of a device envy. I have a device on me which allows me to see my slides a little bit clearer in their glasses, and so thank you very much for the opportunity to talk today. Are the slides visible?
Yes, can we go to the slides?
Thank you very much. I think that there's a lot of things that resonate even in the opening part of the conference really, which is about the presence-based aspect of medicine and what healthcare that we provide to patients. So you have to go somewhere, you have to go to your GP, you have to go to your hospital. It's the only way that actually the healthcare is being constructed, and this is clearly flawed. We have real challenges in our health service really at the moment. Our hospital system, and Martin spoke about the occupancy rates in our hospital system, is extremely high, but it's engineered for 3 or 4 decades ago. It's not engineered for where we're at now. We now have older patients with multi-morbidity who in fact actually do worse in our hospitals at times, actually get deconditioned. And access is a huge problem. Access either an emergency pathway or the scheduled pathway is a big problem. We have 800,000 people waiting an outpatient appointment. We have patients waiting to access emergency care on a day-to-day basis. And equity. We have a 2-tier health system, and I think that is a lot of the problem in the redesign of our health system. And I do think we need to tackle that so someone can be on a private insurance stream and get fast access, and someone without private insurance not fast access. That is wrong in my mind. And I think the biggest challenge that we have within the health service actually is that we're very silo-based and we don't communicate as well as we should. We have multiple healthcare IT platforms, and I'll show you 1 or 2 of those. We have an emphasis on downstream healthcare. So when things are really broken, we have started applying healthcare as opposed to putting patients at the centre, promoting well-being, and digital technologies and digital transformations is a real opportunity for this. And the thing, to be honest, after meeting Martin, really stimulates the neurons, as you know. And actually, the thought occurred to me actually that all the information that we hold, patient X who goes to their GP 5 or 6 times, goes to their pharmacy, goes to their hospital, has been to their emergency department, nearly all of their data is not held by themselves. So they cannot say, look, actually, this is me, this is my last 2 years, really, which actually, when you start thinking in those terms, it's actually quite shocking. All of that data is their own. If they want the data, if they went in a hospital, they have to write an FOI request about their own data. It's quite bizarre when you suddenly start changing your thinking. This is Google Images last night. Actually, if you just Google Images patients, every single one of those patients is present-based in a healthcare institution. Every single one of them is in at least a seated or a lying down position. And every one of them looks as if they're lucky to be the recipient of some wonderful healthcare provider. And actually some of them are quite, again, the first time I ever did that last evening. So it's this kind of almost childlike way that we treat patients at times and don't empower them. And that digital innovation has an opportunity to change that paradigm. This is an important paper actually that was published a number of years ago looking at healthcare, the 60-30-10 rule. About 60% of what we do in healthcare is convincing and adds value. 30% of it is quite dubious. Inappropriate endoscopies, inappropriate MRI scans, multiple medications that patients don't need to be taking, and 10% of it is actively harming patients. And again, by standardising healthcare in a national way, leveraging digital technologies would be a fantastic opportunity to tackle this. But kind of mention about the challenges that we have in healthcare, but we have tremendous assets. We have an incredible workforce, but that workforce predominantly is not as connected as it should be. And this is what it's all about. This is quality in healthcare. So everything that when we're talking about healthcare, everything should be framed in the key components, the 6 key components of quality in healthcare. It should be safe, effective, patient-centered, timely, efficient, and equitable. And if you look at digital transformation and the streams of digital transformation, it does tie into a lot of these components. Safety, effectiveness, patient-centered, obviously, as we've seen already, timely, so that actually it's live, as we saw Martin's heart rate earlier on, and efficient and equitable. And in terms of digital transformation, a lot of people, when you talk to people in healthcare, and I'd say people who are outside this room, and I think there's a job of work to people who are not in the digital transformation tent, they think of gadgets. And really, to be honest, I think there's a danger of saying, actually, we're at a digital transformation conference. What gadgets did you see? Digital transformation of course, is around digital technologies, but also the sole focus of it should be about improving healthcare and as a strategy for healthcare going forward over the next 20 years. And we should be really looking at what is our healthcare going to be like in 20 years' time, and start working back from that now. Start thinking, what is healthcare going to look like? It can't look like the same as it is now. More hospitals, more beds, more sort of deconditioned patients, or long waits for emergency access. It can't. We have to be imaginative and we have to be visionary about that. And this is still live in our hospitals. And I suppose my remit is in hospitals, so I do think with a bit of a hospital focus, that this is still live. This is it's almost like the patient's Bible, that we're slow to give up this case notes, the mythical case notes with the quill. This is an example of a digital transformation strategy. Just Liam Plant, one of our renal physicians, he was head of the National Renal Office on one of the wards this week. That what he's looking at there is live x-rays and an x-ray reporting system. And that to me was the singular transformative thing that happened in 20 years in the hospital that I worked. And it happened on the 1st of July 2008. And everyone was saying, no, this is not going to work, we're not going to have access to the previous x-rays. But over time, obviously, the x-rays built up. And this is absolutely transformative. We have incredible radiologists and radiographers who once the x-ray is done, you can see it. In addition to that, it's reported. And that, to me, if I were to think back at over the last 20 years in the hospital I worked, that actually transformed things. And clearly, when we look at populations, they are very keen. You may not be able to read that slide. 60% of Britons would monitor when asked, said they would monitor their chronic health through a mobile app. 70% of them would like to look at their own health information online, and 80% would like to look at their medical records online. And why wouldn't they? Why wouldn't they? Skip that slide. So digital transformation, I think, as I said, we have to be just slightly careful of the shiny object syndrome, really, that obviously it's all about a little gadget, because that can turn people off the whole notion of digital transformation as a way of transforming our healthcare. So digital technologies are only valuable to the extent that they can be effectively applied to achieve the organisational goals or your visionary goal of delivering healthcare. And these are the type of things that jump out to me, really, to be honest. So implementation of an electronic health record. I genuinely think if we don't have a unified, right across the community, hospital record, we are going to fail in all of these endeavours. And I know it's difficult, and I know it's obviously, Martin said it cost a cup of coffee, I think, but we'll hear more about that, obviously, whether it's that cheap. But unless we have a unified record that is visible to the hospital, the emergency department, to the general practitioner, to the pharmacy, to the patient, we're on a hiding to nothing, so we should start building that now. The benefits of this would obviously, you could standardise care processes. Analytics, I think, really the use of big data, from the point of view of operational performance, which I would have an interest in, is extremely useful and a good fallout of digital innovation. And then obviously implement population health programs, integration of care across multiple venues, I've spoken to that, and creation of digital front door capabilities and the use of telehealth platforms. I'll skip that slide, but maybe just where I have the red ring on, really, just about workflow improvement. And I do think that there are challenges in people working together, and I think this could be a great early win for digital transformation, is how we connect each other, all of the people in our various silos. And there's other things that I mentioned in the slide, but for the sake of time, I won't go through them all. And these are a typical hospital information management system. They're multiple across a lot of domains: patient administration, clinical suites, clinical support suites, material management suites, revenue management suites, and support modules. They're absolutely confounding. I have about 6 different passwords for 6 clinical applications. Mostly I can't remember them. Mostly I use the junior doctors' passwords now at this stage, because I just can't remember. They're changing so quickly after cyber. And there should be a login of some description, whether it's that or a retinal scan or a thumbprint that allows you to access, and it's crazy. Operational performance, I think, and use of big data, I think, is a real opportunity for digital transformation. The photo on the right is our that photograph is our operational hub in the Cork University Hospital. We opened it about a year and a half ago to look at the various moving parts that happen in the hospital, rather than saying let's hope everything will work out on the day. It mostly doesn't. So we have an operational hub, which again using screens that obviously show key moving parts and key moving points in the hospital. The screen on the right looks at the previous day's activity, admissions, discharges, the amount of people in intensive care, the amount of people waiting to go to intensive care. There's a little piece there which is, I don't think is a pointer, the admissions and discharges in the previous 24 hours, but there's lots of data, and there are other screens as well. But then you turn around, and which hasn't been digitised, is a whiteboard with various things scrawled on it, which is actually a diagnostics board of diagnostics. So you know, we're behind the curve, and I think that there's a real opportunity here. If you look at John Hopkins, this is their, they call it their command and control centre. And that's looking at all the moving parts and to support the work in the hospital. And this often doesn't get a lot of attention. When we look at the estimates process for the health service, it's more doctors, more nurses, more physiotherapists, all required. But the logistical people that actually allow people to do their work, they're extremely important and overlooked all the time. That's the Chief Administrative Officer of John Hopkins, Jim Shullen, and he's not saying there, I actually smiled when I saw the photograph, he's not saying this works so well, I took a day off yesterday and I nearly caught a fish this big, so that's the type of approach really, that they get serious approach really to actually running health. Hospitals are complex environments, but they're not that complex. The same thing that happens in a hospital on Monday happens on a Tuesday, happens on a Wednesday, happens on a Thursday and a Friday. And just briefly, if I can, really just to maybe just give the ghost of Christmas past, present and future. And I will watch my time really here. So this is the 24th of December. Sorry, that should be the 24th of December 2001. A patient was admitted from Kerry. Was presented with an acute stroke, a quite dense weakness on the left side in 2001, and I do apologise for mislabeling that slide. That patient was admitted to Kerry because at that time the interventions for acute stroke were very little. That patient was put to the back of the queue from the point of view of the admission activity of the doctors, with no real adverse outcome. This CT scan showed an extremely dense right middle cerebral artery stroke, so that area on where the arrow was pointing to, and the patient was put into bed, nursed well, and ultimately died over a 14-day period with a devastating stroke. You fast forward to last Christmas, really, 24th of December 2021, this is what happened. Similar patient presented to Kerry. What happened was there was an activation of, I should go to this one first, there was an activation, the patient was admitted, brought by ambulance by 999, seen rapidly because acute early interventions in this stroke make a difference, and that patient had a CT scan and a CT angiogram done in Kerry. That CT angiogram was uploaded to a piece of software which actually uses artificial intelligence to actually determine whether there's a large vessel occlusion. In stroke, if you have a large vessel, obviously with stroke you can bleed, or you can block your blood vessel. You can block a very tiny blood vessel that you can't get a clot out in, but you can block a big vessel that you can get a clot out. And these patients do very well with this specific intervention, which we'll go on to in a second. So as a consequence of that CT and that platform, the stroke team were activated, and indeed actually protocol 37 was activated, which is a National Ambulance Service protocol, which means immediate inter-hospital transfer. And the pictures that you can see there, the National Ambulance Command and Control Centre in Tala. And if you haven't seen that place, you should go see it actually, it's absolutely incredible. The patient was transferred to Cork University Hospital in the neurovascular suite, done by, had a thrombectomy. And you can see, I'm no expert on images and certainly sort of intravascular imaging, but you can see on the image here where we have no flow and then post removal of this tiny clot, which is no bigger than the top of your pen, which could cause devastating stroke disease. The patient made a good recovery. However, though, so we're talking about 2021, they then appear as a patient on the whiteboard on the ward, and their case notes are there along with other people's case notes. So we have this very high-end, blended, not quite technology that we need to get our head around. And I do come back to that point actually about the healthcare record, that unless we get a shared healthcare record across the system, we're in a hiding to nothing. Then, which is even more bizarre actually, is as the patient left, they left with this letter to their GP, which summarised, which most of the time actually doesn't get to the GP, which summarises the complexity of their admission episode. And that to me really isn't about sharing information. It's not that the GP wants to know every piece of information, of course they don't, but there should be a technological enabler that obviously what we know about the patient, the GP knows and the patient themselves know. So the future then really, to be honest, what's going to happen and we go to 2041, again, speaking to that point, the patient comes in, the front end of the journey is the same. They come into the hospital in Kerry, they have their CT scan done, there might be some other interventions at that stage. We don't know obviously what science is going to bring us over the next 20 years, but the patient is transferred. The records that are updated in Kerry are updated in Cork at the same time and are updated in the GP's surgery, and in addition to that on the patient's device. So everything that is happening at a healthcare point is actually being updated in a cloud-based piece of data. And in addition to that, when the patient goes home, their prescription flashes to the pharmacy. In addition to that, the GP is aware of obviously what has happened. There might be an instruction order, which is have your blood pressure monitored by a remote monitor, as Martin was speaking about. The patient goes home, puts their remote monitor on, that's flashed to the GP. It's high, the GP sent the flash prescription back, as opposed to tracking patients forward and backwards. So stay left, shift left, that's where we're going, that's the strategy really effectively, and that whole notion of ecosystems of health, obviously, where there's a huge amount of connectivity. We've seen that slide before, and it's quite correct. We have a very hospital-focused healthcare, and obviously primary care, which is extremely strong. And I would say, just for primary care colleagues, there was a study done last year actually looking at workload. It's 23 million GP consultations done per year. There are about 440,000 general practitioner consultations, and it's about 9 million per year, 440,000 per week general practitioner consultations. So they are the absolute workforce, primary care's workforce, the real strength really behind obviously our health system, and about 9 million practice nurse consultations per year. You think of all those touch points, and again, sort of that presence-based aspect of things, and how many of them would not need to be face-to-face contacts? How many of them, if we were using and enabling digital health, and it free up time to do other things to attack health in a more preventative manner? It's all about the people though, so obviously the shiny gadgets and the connection, but it's all about the people. So from Sitting Bull, as individual fingers we can easily be broken, but together we make a mighty fist. But the problem is that togetherness, and we saw that fantastically in the health service actually, like over the last 2 years in COVID, we saw that togetherness like I'd never seen in the health service. It was incredible to work in the health service, but we need to enable that togetherness. This man I think is fantastic, Don Berwick actually, I could listen to him all day. He is a paediatrician and a quality improvement guru, but he said you don't get excellence from pieces, you get excellence from connections. And there's always pockets of excellence, but you want to make them connected. And I think really, I suppose, echoing what was said before, that's my last slide, Martin, just that actually that we should think about what is it going to look like. Today is the 24th of March 2022, or 25th of March I should say. So we should think about what's how many working days and what do we have to do. The answer actually is 7,504, actually, if you're wondering, but actually over that period of time, what do we aim to do in healthcare? How do we leverage digital transformation to do that and start working on that now? The health service, traditionally, because it's constructed that way, works in the short term, barely medium term, and often doesn't apply itself to strategy as well as it should. And I think this is a wonderful opportunity by harnessing digital transformation to do something meaningful for the future for our healthcare. So thank you.
very much, Mike, and it is so reassuring to see brilliant doctors like Mike, really thinking digital. And fortunately, Colin Henry, our CCO, couldn't be with us here today. He did send a very nice text last night to say, hope it goes well, and he's with us on the journey. Just to mention, Mike mentioned actually one area where we are not lagging but leading is with the NIMS system. So we potentially have the largest database of x-rays and other radiology content in the world, and that's going to be a fantastic opportunity for AI. Just to say, what we're doing in Ireland is actually making global attention, and we're actually going to be joined at lunch by Neil de Crescenzo. He's the global CEO of Change Health, who actually are implementing that. He lives in Tennessee, but he's going to be joining us for lunch. So it's my great pleasure now to introduce somebody whose face you know very well, has been a voice of calm and reassurance through the COVID-19 crisis. I think him or Tony Holohan, vie for who's the most recognised face. I had the privilege of working with Professor Philip Nolan at Maynooth, and what was achieved in Maynooth University and Professor Nolan's tenure is just remarkable. The campus is unrecognisable, and the achievements and the influence of the university, Maynooth has really leaped forward. So without further ado, please welcome the new Director General CEO of Science Foundation Ireland.
Thank you very much, Martin. Just as anxiety causes tachycardia, so does embarrassment. So I'm glad they're not monitoring my heart rate right now. I was attended the funeral of a academic, the father of an academic colleague recently, and just as he stood up to give the eulogy, one of his close friends and mine leaned over to me and says, "He looks a bit lost without the PowerPoint." So I'd say that by way of introduction. Nobody but Martin would have the ambition to try and fit 15 keynotes into 90 minutes. In the interest of sticking to time, I've decided to do this without the comfort and security of PowerPoint. I'm delighted to be here, and I'm delighted to, on behalf of Science Foundation Ireland, offer our support as a research and innovation agency for something very specific, which is a multi-agency collaborative program stretching across Science Foundation Ireland, the Health Research Board, the Health Services Executive, and the Irish Research Council. I haven't asked all of them to do this, but I will, to support a multi-agency collaborative program to support this very wonderful stay left, shift left agenda. And I think if you were just listening to Mike's presentation there, you can see the very obvious impacts of this agenda on the health system and why it's worthy of our support. And what I mean by that is I think we really can seize the opportunity to take a data-centred digital transformation of population health and health services along Sláinte Care principles and achieve outcomes, transformative outcomes for citizens, for patients, for communities through that work. And not only, I think, as Orlaigh Quinn pointed out, not only will that have benefits for people, for health and for populations, but we'll also fuel a wider product and services innovation ecosystem within Ireland. And in making that pitch that I think we as a research funding agency can assist greatly in this agenda, I also want to very clearly state that this is not a technical problem, and people have alluded to that. It's not about technologies. This is a socio-technical problem. What we need to do here is understand what is the motivation and the needs and the desires of individuals and of communities, and engage them in partnership to co-design solutions that are meaningful and useful for them. And there are really deep issues. I thought Minister Ryan really hit the nail on the head when he talked about something that I plan to talk about, issues of privacy, security and trust. So this is about, from the perspective of the individual citizen or patient, what's useful, what's meaningful, and what addresses their concerns about privacy, security and trust, and what changes the dialogue with those citizens from concerns about their data to owning their data and being empowered to share that data for their benefit and for the benefit of their community. So So even though I fund a hardcore technical research agenda, and that's what I'm supposed to do, our concern is that that research drives transformation, which is citizen-centred, community-focused, but digitally enabled, and that it's aimed towards objectives, specifically in the case of healthcare, but more generally across society, around issues such as quality, equity, and solidarity. And I'm basing that, I'm quite passionate about this, it's something I'm driving at the agency, and I base that passion on two experiences which I briefly want to share with you. One is the national pandemic response that's been alluded to. And before I say anything about the inadequacy of that response, I just want to pay tribute to, I think Mike said this, it was a privilege to work in the system at this time of crisis because it brought out the very best in people. So before I kind of say what went wrong, I want to pay tribute to the expertise, experience, and I've written these words down because they mean a lot to me. Expertise, experience, professionalism, commitment, determination, creativity, and resilience of colleagues right across the system. But in the context I operate in, I want to say particularly of those colleagues in regional and national public health structures, in the health protection and surveillance centre, you will never know how hard those people worked and how much they achieved with very, very limited resources and technology. And the HSE information systems team, they stood up some remarkable things in that period of time. What we needed to manage the pandemic was local and regional management of the disease with and for the communities that those regional public health departments served. Unfortunately, those departments were under-resourced for that task and under-equipped for that task, but still did extraordinary things within those resources, and then overseen by national policy responses. And to inform that, what we needed was real-time information about disease, the severity of that disease, the level of protection against disease through vaccination, the mobility of people and their level of social interaction. What we had was disparate, separate, unintegrated, sometimes stood up in an emergency and served the immediate need very well, but didn't serve the system-wide need well. In some cases, aging information systems. The system of record was CIDR, the computerized infectious disease record. The fact that the first word is computerized dates that to the 1980s, when the mere computerization of it was an innovation. And despite then some really outstanding work by the Central Statistics Office to join up these different records, and only they could do it because of concerns about the privacy of individual citizens' data. They're the only state agency authorised to join these things up. Despite their work, because we don't have implementation of an individual health identifier, we simply could not link those records. So it was impossible to tell quickly who's been hospitalised, how severely ill they were, whether they were vaccinated or not vaccinated. That simple data which we badly needed was not there. We managed, but we were hampered significantly in our response. And one of the things that I want to highlight is that with the collaboration of colleagues in the HSE, behind the scenes, we could deploy colleagues from the SFI Insight Data Science Centre into the HSE as a data engineering project. We didn't even get as far as big data, artificial intelligence, because the original data was just simply so dirty we couldn't use it. This was a data engineering task to get in there, and how could we link up these data sets. So I think that's important, but it highlights the deeper issue, which the Minister alluded to, and that is the biggest problem we face here is issues of data ownership and data governance within and across agencies. And actually the wider issue of how we approach data governance. We simply approach it in a defensive manner. What we did, for instance, the mobile app that was used, which was effective in many respects, but to ensure that there could be no issues whatsoever about data privacy. All of the useful data about geolocation of where the person was, the identity of who they might have encountered, were completely stripped out of it, and we couldn't see patterns of movement or patterns of contact in that data. So we stripped out geospatial and personal information to ensure that there could be no possibility of intruding on issues of privacy or security. And that really lost opportunities for us. Rather than a proactive and empowering approach that says, this is your data, we respect your privacy, but we're going to share it in the following ways to protect your health, which I think will be important. And I want to acknowledge here for two reasons. First of all, because Maynooth University was the progenitor of it, in part because of Martin's presence there, and secondly because it's SFI funded. One of our significant programs is a program called Empower, and Martin Selfridge is here from that program, which is about shifting our attitudes to data governance, to empowering citizens to use their data appropriately. So, if I can close out on that example, what we need is really strong regional departments of public health with strong national policy and data support in organisations like the HPSC, but we need, I think, something stronger than that. We need a national notifiable disease case outbreak and response management system, and ideally that would include very innovative socio-technical approaches, including citizen location data when they're willing to share it if we're managing major outbreaks within the community. And then very quickly, the second experience is that prior to the pandemic and interrupted by it, I was asked by the Minister for Health to help to review the national system of cardiovascular care, very close to the stroke analogy that we had, and propose a new architecture. And that report will come out in a short period of time. And we'll recommend that cardiovascular care be organised into a set of regional networks with the focus on supporting the health and well-being of people with chest pain, rhythm disorders and heart failure in their communities. And then a tiered approach through primary care centres, Model 3 hospitals with specific remits, Model 4 interventional centres, and then 4 major national interventional cardiology centres. The one thing that everybody needs to do that is an electronic health record and a cardiovascular information system, so that the patient's data, we have these bizarre things where procedures are being done in major centres and then the follow-up has to happen in the major centre because the regional centre doesn't have access to the patient. So again, we're looking here for data-driven, citizen empowering approaches. What do we need to support this culture? First thing that we need is investment in talent and professionalism. The kind of innovations that you see here are grounded in the fact that we educate people to a very high level in a very wide range of disciplines. And when they come together, they have the capacity to do innovative and creative things. We need really deep technical research capacity. So in institutions like Kerstin's institution, and I just mentioned it briefly, that when we started to model, it's interesting that the Minister mentioned this there, when we started to model the spread of the virus in Ireland, one of the resources we drew on was Professor James Gleeson in Kerstin's University. Another thing that James had been working on was actually the spread of misinformation on Twitter. And you hear about going viral. And of course, the abstract processes of viral transmission and information transmission reduced to the same mathematical equations. Receiving the tweet is a bit like being infected. The length of time it takes you to retweet it is the latent period, and the number of people that read it is the reproduction number of the tweet. But having that capacity, he wasn't funded by SFI to do infectious disease modelling. He was funded by SFI to apply mathematics to really challenging problems, and when we needed him, he was there. Same with Jim Duggan in Galway, Chris Brunson doing geospatial data in Maynooth, and so on. And the other thing I'd say is, there's been a lot of talk about AI and big data. The more AI and big data we do, the more we expose some really fundamental problems in probability and statistics. And we need those people to keep the AI ship pointed in the right direction. Otherwise, we could find ourselves, drawing conclusions that are simply not valid. We need to invest in people. We need to have that deep research technical capacity. And then there is the real challenge of fostering, and Martin will know more about this than I would, fostering open innovation and at the same time systemic transformation. And I think what we need there is autonomy, that you can try your innovation, you can experiment, but then there need to be frameworks for interoperability. And I really would advocate that one way to move this on is to to tackle some exemplar projects with ambition, and certainly the ones that would be of interest to me would be around notifiable diseases and cardiovascular inflammation. But even with them, the danger is of isolated interventions, and you do something for cardiovascular disease and you forget about stroke, for instance, and you've got two unjoined challenges. So I like the notion of making connection. One of the fundamental disciplines we're going to need is around data engineering and the governance component of that. And how do we govern our data? And for that reason, what I'll be pushing for in support of this agenda is that trans-agency. Actually, the work needs to start with the social scientists and the humanities scholars. I was very touched by my comment about what we do between now and 2042, and we laughed a little bit, but that'll come really quickly. I remember when I was 5 or 6, I turned to my father and asked him to explain what was retirement. He'd come home and said he'd been at a retirement party. And he said, well, you know, it's when you finish work and you don't have to work anymore, but they continue to pay you. So that was a fascinating concept. And he then explained to me, being the civil servant he was, that you were entitled to retire in the September following your 65th birthday. And I went up to my bedroom and calculated that I'd be entitled to this freebie on the 1st of September 2032. And I'm now kind of struck by how quickly through my working life, with much less done than I would like to do, I'm approaching September 2032. So what I'd appeal for and support is that we take a trans-agency. We need vision, and vision is going to come as much from the humanities and social sciences as it is from technical people like me or medical professionals. So that's why the programme that supports this needs to stretch right across from the Irish Research Council to Science Foundation Ireland and out into Enterprise Ireland and IDA. And I look forward, I've been fascinated by what I've heard already this morning. Was that finger the 1 minute warning? which is timely. I'm fascinated by what I've heard this morning. Look forward to hearing more. But pledge to you as a community the ongoing support of my agency. But I think more importantly, I think there's an opportunity for my agency and others to show leadership right across the higher education innovation system in support of an agenda that will, by 2042, have transformed the lives of our citizens and our patients. Thank you very much indeed.
That was seminal. I always learn so much and I'm always surprised, and you can see why Philip is the new Director General of SFI, but it's brilliant to have you. Philip's actually going to stay today with us, and what we're going to do after the break is actually we're going to show 10x innovations. Most of them haven't been seen before. It's going to be really exciting. We have 2 final keynote speakers. I know people will want coffee, but they're well worth waiting for. Absolutely thrilled to have Russel Branzel. He is the President and CEO of CHIME, the College of Healthcare Information Management Executives, who lives in Florida, with us today as a penultimate keynote speaker. Russell's been at the forefront of actually driving digital health education worldwide, and we've been working to see how we can collaborate over the last 2 or 3 years. So Russ, we're really appreciative that you are joining us, and please give Russ a very warm mid-lance welcome.
What an honor and privilege it is always to be back in Ireland. Matter of fact, my last big business trip was on March 6th as I left on a plane, not to know that as I hit the ground, the entire world would be locked down. So my next big business trip was back to Ireland, and just to pick off where we left off. But thank you so much, Martin. I thank you for the partnership, the friendship, and the encouragement to try to do the right things. CHIME's a big company. We are in 58 countries around the world. We do all kinds of crazy things like professional training, certification, education. But one of the biggest things we do is a survey. And last year we did a survey of 36,000 entities around the world on their digital transformation and major initiatives. So we were able to pull some epiphanies out of this. But I'll start with just a quick thought, maybe just a ground setting. As we've made some kind of thoughts along the way, some beliefs. So a lot of this is going to be based on belief. And that is, I do know something about you, looking around in the crowd, looking around at most of you, I believe all of you. And that is, every single one of you was born into, raised, educated, formally trained, professionally trained, started all your employment in only one economic revolution. That was called the information age. None of you were part of the Industrial Revolution, I don't think, looking around. Every one of you only know one set of rules. The information age. That's all you know. You don't know what you don't know. When you think about that we are playing by a single set of rules, and every one of us was hardwired into our system. But if you talk to a lot of economists, and I teach at Columbia University and a couple of the universities, and get to hear some really bright economists, general belief is the information age is actually done. We're in a new age, a new economic revolution. They're not sure what to call it, just like they didn't know what to call the information age for 30 or 40 years. Some now are calling it the AI age. Most believe that stands for artificial intelligence. I call it advanced intelligence, because that's exactly what Martin's talking about with this new initiative, to move things to the left. But here's the concern we have as we go into these major digital initiatives. We often get asked, based on all the data we have and the people we're involved with, what's the number one reason you believe, and again, I'll say belief, that digital transformation initiatives fail? Martin gave the numbers of those. Lots of people do different reasons. Our belief is, this was confirmed actually doing some teaching here yesterday with some of the leaders of the HSE, that is not change management. Because change management is a information age skill. It is change leadership. Matter of fact, a vast majority of you, with maybe a few of you that are in the behavioral health, have this skill, but a vast majority of us, probably including myself and Martin and others, have never been formally trained on how to help human beings through this massive change they're going to go through. The reality is, we're about to go through, and I absolutely love it. I love the technology, I love the software, I love the services that we're going to have. But the reality is we're about to go through the biggest human change in the history of humanity. And this initiative, which I believe is going to be one of the most amazing things to benchmark against across the globe. And we get to benchmark all kinds of different programs and share around the world. And Martin will be busy because I'll put him on the road speaking as this thing is a success. But the reality is, we've got to think about this from a much more humanistic perspective. Again, why do two organizations in the same city, both putting the same EMR in the same way with the same project managers, one fails miserably and the other one's a huge success? They forgot to take the people along the journey. Listening to just HSE leaders this week, every concern they have is not about the technology. It's not concerned about technical process or project management. It's about how this is going to affect people. So as we move forward and we think about this, it's going to mean we have to think differently about the people. We're going to have to think differently about the HSE professionals that are out there. It was interesting yesterday with a whole bunch of senior folks from the HSE. We talked about this and I said, tell me one job in the entire HSE that doesn't need to have its job description written and have an entire section put in there for digital skills improvement. And they couldn't come up with one. Patient transport people made note, they're going to be using iPads, wayfinding, so many new technologies. Patients will actually be mapped and be on different things. There's not one job that doesn't need massive digital training and improvements. That's globally too. You know, our academic partners, which we actually have one here in this country, we're so proud of, our friends at University of Limerick and China University are actually a great partner in a master's program that, thank you Martin, you encouraged us to do. It's in its infancy because as we started it, 2 weeks later, we happened to have a world pandemic, but you know, we'll continue to push that. But now we need to think about partnering in ways we never have before. I think one of the earlier speakers may have said it. Most of the technology, and many new technologies will be created, is out there today. Actually, the lessons have been learned in ways that have never been learned before as well. We just don't want everybody to try to reinvent those same problems and mistakes again. So that's what I think one of our biggest initiatives that we can do, which is to find a way to share like we've never shared before. A global platform of sharing the lessons that we have. I mean, I cannot wait to see what happens with stay left and shift left, because it's absolutely the right thing. But we have to figure out really quickly, back to the analogy of the economic revolutions, how to completely unwire our thinking and rewire ourselves into a whole new economic model of thinking. Perfect example. I don't want patient-centered care. I want human-centered care. Because I'm only going to be a patient this much of my life. But I'm going to be hopefully a human all the rest of the time, or all the time. We are so wired. I know I am. I am wired into a hospital-centric, physician office-centric, current healthcare system-centric mindset. And if we're really going to get to what exactly is on that form, moving to the left, we got to rewire ourselves, which means, we just talked about how much the HSE team needs to get reskilled. We all have to get reskilled. This is something we've never really had to. We have to question ourselves and do some self-reflection, like we've never done before. I just started my doctorate in digital health. What I discovered in the first 2 classes, I don't know squat. Seriously, what I've learned in the first 2 classes has blown my mind, which means for a person who admittedly, egotistically, thought he knew a bunch of stuff, I'm realizing, wow, we have got to learn a lot more. And that's what I think we can do this together. Now, with that being said, I'm unbelievably excited about what's happening here, and I know I've told Martin that before. You've got my entire support. They've got their maturity model, we've got ours, but we've already volunteered to put the 2 databases together to make sure we can benchmark across the whole world. There is nothing proprietary about what we do at Chime. We're glad to share anything and everything we can with this great country. And admittedly, I do like this country a lot, so anytime you need me to come over and help, I'm more than glad to. And I go quoted as saying, the nicest people on the entire planet are here in this country. So with that, we wish you the best. We want to be part of that great human change with you. Thank you and take care. God bless.
That was absolutely awesome. Thanks so much, Russ, for being with us, and you'll be with us anytime. Before we go to President Kerstin May, we're actually just going to go live to the web, and we have Sheehan, the General Manager of Microsoft Ireland, who is a strong supporter. So we're going to hear later from Martin Shanahan how many of the large companies have lined up with the HSE to support us. We were really privileged to meet with Anne a couple of weeks ago, and Anne, lovely that you can join us here, and hope you can hear us, and thanks for waiting so patiently. Just to mention, we were hacked on Zoom. We actually have an idea who it was, but we won't say any more. But we met a couple of weeks ago, and actually out of that meeting, John Sheehan is going to show a remarkable innovation that just happened in 2 weeks. But Microsoft's an incredibly important company for Ireland. It's an incredibly important company, worldwide. It's actually created a whole new business language, Word and Microsoft and Excel. The whole world. I worked for Intel, and when I was at Intel, we thought we ran the world. It was actually Microsoft. We just provided the electrons. So Anne, it's just such a real pleasure to welcome you. Anne would have loved to been here today. I don't know if I can say that, Anne, but...
And I have COVID, unfortunately, so yeah, apologies that I can't be with you, but better that I stay away, I think, in isolation.
Brilliant. So Anne, you have the floor, and thanks so much for joining us.
Great. So good morning, everybody. And as Martin said, my sincere apologies. I have been hit by COVID over the last few days. So, but for the power of technology, thankfully I can be virtually in the room with you today. So on behalf of Microsoft, I'm delighted to support what is a really exciting and ambitious initiative to build on the advancements and innovation in digital healthcare. I really want to sincerely thank Martin and his team for inviting us to be part of this great gathering today, and for bringing us all together in a spirit of collaboration to design and test new ways to accelerate the digital transformation of healthcare in Ireland with the stay left, shift left 10x approach. I think all of us represented here today share one collective goal, and that's to leverage our strengths and capabilities to support the HSE to deliver better healthcare to every citizen in Ireland. And at Microsoft, we see the greater use of technology as one of the ways that patients, clinicians, and the wider healthcare professionals can achieve this. And the impact of COVID-19 in our society has brought public health to the top of the policy agenda. The pandemic highlighted the vital need to build resilience in our health systems and underlines the critical importance of a well-functioning, effective and secure technology platform for healthcare in Ireland. And of this we can have now, no doubt. And we've already seen more digital transformation. I think we've all talked about this morning in the last 2 years than we've seen in the last decade. And I think it's behooves on us all to make sure that we continue this momentum. So we're very proud in Microsoft to work with the HSE, and we've had the opportunity to deliver incredible substantive changes to support public healthcare efforts, focusing on guidance, testing and care in response to COVID-19. And we've really seen what's possible in terms of the development of new technology solutions and the speed of adoption to manage really difficult situations. The HSE embraced several new digital tools that not only provided flexibility, scale and responsiveness, but they also helped the organisation to gather insights from large amounts of data through the use of digital-based systems. New health technologies such as cloud-based data lake platforms were used to collect COVID-19 data in real time. AI-based technology was implemented through the COVID-19 triage health chatbot, and pre-existing e-health tools such as e-prescribing and e-referrals and telemedicine were increasingly adopted and used over the pandemic period. Together with our partners, we provided a comprehensive platform to support and deliver data in real time at a level of quality and accuracy that really helped the HSE, the Department of Health and our politicians to make the best possible decisions during the course of what was really a difficult time for our country, healthcare systems and our citizens. What became hugely apparent though was the increasing role of data and how it informed key decisions. So through platforms such as Azure Dynamics 365, our Power Platform, we brought several different data sources across the journey of citizens and patients, from testing to initial information around their case, to their admission into hospital, right through to ongoing care and management of those patients. And we've all worked together with the HSE to harness data to support resource planning, such as visibility of caseloads in different parts of the country to identify where resources were most needed. The adoption of these innovations shows what our health system is capable of implementing in a really short period of time. We've seen 10 years worth of transformation in the span of a 2-year period by using new tools, working together and having new ways of operating. Now is the time for us to further strengthen these improvements and successes to build a resilient leading healthcare system for future generations and to support the innovation initiatives by Martin and the team. So according to our recent research report, Digital Ireland Inclusive Recovery, which gathered views from businesses and technology leaders across all sectors, leaders in healthcare are more likely to say they are only at the beginning of their technology journey when it comes to empowering employees through collaboration as well as digitalising services. This indicates an appetite for continued change and transformation in the provision of healthcare that has been ignited over the last 2 years. And being connected to care is now critical more than ever before. This is what patients of healthcare organisations are asking for. The connection between patients, care systems and data has been fundamental to delivering the best possible care and outcomes. We see 3 core areas where Microsoft technology supports healthcare. The first is the use of technology to better engage patients. We know that as more engaged the patient is in their own care, the less likely they will need to visit acute settings. And we also know that patients are actively seeking digital tools that allow them to be seen by healthcare professionals without leaving their homes. Whether through virtual care to facilitate communication between clinicians and patients, or harnessing data through wearables, as we've seen this morning, so clinicians can understand a patient's solution. We see our support in enabling patient data to flow securely across the care continuum, creating individual patient care experiences. These options help patients remain proactive in their care. The second area is around empowering collaboration amongst healthcare teams. We know that healthcare teams are stretched at all times, not just during COVID, and there will continue to be pressures on the health systems, particularly as we see at the moment around waiting lists. Care teams need the ability to coordinate, to manage care, to understand patient flow, to understand where the pressure points are and have the tools to be able to share information in a secure way. Empowering health team collaboration makes it faster, easier to coordinate care, collaborate on views of a patient, and continually monitor patients across locations. And the final area, which is critically important, is improving clinical and operational insights. By gathering which was once siloed data and applying advanced analytics and AI to get insights, better, smarter, operational and clinical decisions can be made. This means improving what's delivered to patients via the data and insights, both in a clinical and operational perspective, to understand where care is being delivered, where outcomes are positive, and where we're achieving better results. Embracing data-led strategies that emphasise prevention is critical to protecting staff, bolstering efficiencies, and improving the quality of patients' lives. And there are significant degrees of innovation and adoption of technologies happening in healthcare worldwide. COVID de Beira Hospital in Portugal provides a tangible example of what's possible. This hospital developed a platform that allows doctors to remotely monitor vulnerable patients with chronic conditions, keeping a watch on key variables like blood pressure and weight. AI-powered tools can actually spot early trouble signs and alert doctors when new preemptive measures can be taken. And this approach has resulted in a dramatic reduction in patients' need to visit hospital. The numbers speak for themselves, a reduction of 85% in visits to emergency departments and 62% reduction in hospital admissions. Closer to home, and some of you may be aware, a multidisciplinary team in UCD's AI for Healthcare Hub are working on a new prototype AI diagnostic test for preeclampsia, developed that will hopefully save thousands of lives around the world. Using cloud-based technology, they've developed a prototype AI-based machine learning tool called AI Premi that has shown great promise in identifying preeclampsia when it develops and how severe it will become, enabling critical teams to hopefully make vital life-saving decisions for babies and mothers in real time. And there's so many more examples of innovation happening in Ireland, and I'm sure you'll all get the opportunity to see the demos later on this morning. And one example is from Dr. John Sheehan from the Blackrock Health Hermitage and Blackrock Clinics, who will be using the Microsoft HoloLens 2 for a live interactive cloud-based mixed reality demo. And VSI HoloMedicine is a software platform that leverages the Microsoft HoloLens 2 hardware to transform medical images such as MRI and CT into 3D mixed reality environment, allowing teaching for medical students and doctors, demonstrating findings to patients, planning complex surgeries, and ultimately assisting in these procedures in the operating room, resulting in 10x better, faster, and cheaper patient care. So please find John, I'm sure he'll be in the room someplace. So just to finish up, I guess reflecting on the last 2 years, it's evident that the healthcare industry has proven it has an ability to innovate at an innovative pace. Today there's an opportunity and an imperative to continue on that path and get on the front foot, augmenting healthcare systems so they can focus on keeping patients healthy, not helping them when they are acutely sick. We are really encouraged to see health service embark on an innovative journey and to be looking at new approaches with new technologies to support healthcare teams through quality data and patient engagements. We see a really positive journey for the HSE. Microsoft is excited to continue to work with the HSE and with Martin and his team. We look forward to collaborating on the Stay Left, Shift Left 10X, which looks to make sure that we adopt technologies to stay ahead of the curve on both the national and international level. So thank you, and thank you, Martin.
Thank you so much, and we really appreciate you taking the time, even though you're sick, and I think that was very sort of, if I may say, stateswomanly, and it's really important. We were with Anna O'Leary from Vodafone last night, and she got a special recognition award, and John Swords and I were talking to her afterwards, and she said about encouraging and role modelling female leaders. She said, if you can't see it, you can't be it. So it is fantastic to have, you know, Anne as the new head of Microsoft in Ireland, actually supporting this initiative, being a brilliant role model. And Anne O'Leary also committed Vodafone to stay left, shift left 10x last night as well. That's great. And we're actually collaborating on a remarkable project in Clare Island, also with Cisco. It won the GovTech Award, and we're going to make, hopefully, the Clare Islanders the most healthy islanders in the world by actually detecting disease before it happens. So thanks so much, Anne. I hope you can get some rest now. Look forward to meeting you very soon.
Take care. Enjoy the rest of the day.
Just special announcements. We have made overnight reservations, and to let you know, we will be continuing at 9 in the morning. So last but not least, and thank you for your patience. Look, I think the quality and the calibre of the speakers we have. Professor Kerstin May is a breath of fresh air into Irish healthcare. The very first step on digital transformation is education. We decided we wanted to build a new master's. We got all of the professors together. Colin Henry and other leaders backed it. And one of Professor May's people, Annette McGilligan, stood up and said, I'm going to do this. We delivered a year ahead of schedule. So this is really within the spirit of Agile. Let's do this. So please welcome Professor Kerstin May, President of UL. Do up the slides for Professor May. And then we promise you we have coffee.
Good morning, everyone. Thank you very much for the invitation to be here. I'm going to talk about the MSc in digital health transformation. Can I move the slides?
No, you'll have to just say next slide.
Sorry. So next slide, please. The MSc Digital Health Transformation has come into being in the context of the implementation of Sláinte Care. And as we heard before, in order to drive innovation, it's not just about the technology, it's about the human beings to create awareness and education. I would like the next slide, please, because you heard a lot about the stay left, shift left initiative, so I'm not going to rehearse it. But in terms of driving the digital innovation, the first steps to take are to focus on awareness and education. So Professor Martin Curley brought together, as he said himself, the digital health experts in the sector, in academia, and the need for educations were identified, and in addition to that, the complementary expertise across the universities in Ireland. So what was happening in that context is that the universities got together to co-design and basically co-deliver a new masters for clinicians in digital health transformation. As you can imagine, universities working together, creating a new masters, the masters needs to be accredited. It's quite a complex issue. UL stepped up, and I was then the Vice President Academic Affairs. I had to deal with the accreditation process. We all worked aligned and made it work so that we could actually get the masters off to a quick start. And I'd like the next slide, please. To a quick start, as part of the Digital Academy, as one of the 5 columns for digital transformation in the health system, the aims of the masters were to support the compliance with standards and regulations and governance systems, and to foster the knowledge about the healthcare ecosystem developments, to engage patients, providers, players, policymakers, pharmacies, etc., to facilitate collaboration, and to lead core adjacent and transformation innovations in the healthcare environment by taking a disciplined approach to advancing the understanding of exponential technologies and to realize the transformative power of digital disruptions. Next slide, please. Next slide. So it was launched in January 2020, and normally when a new MSc is being launched, we are happy to get 10 or 15 students. This MSc attracted expression of interest from over 200 clinicians to participate. a cohort of 50 supported by HSE scholarships started and has now been grown to over 100 on the MSc. And it is being delivered in a hybrid manner, i.e. much of the content is available online for the 18 months program, but there are in-house sessions in the universities that participate in it, as well as residency programs in the University of Limerick on a Friday and a Saturday to support also the face-to-face, the networking that is really important in order to share experience, best practice, and ideas. Next slide, please. Next slide. What's new in the MSc for digital health transformation is that normally an MSc includes a 30,000 word dissertation. That has been scrapped and has been replaced with a digital change project, where the students basically suggest a project that is developed within their own context of working and will have very concrete applications. And the first cohort developed 21 change projects. 18 of them were deemed viable, and that is really remarkable. We heard earlier that the failure rate for change projects in that space is up to 70%. So 18% were deemed viable. And I would like to go to two examples here. One is Lorraine Smith's project. Lorraine received the National Health Award, and she developed a project in response to COVID-19 in order to avoid that patients with COVID-19 had to be hospitalized. The savings from that project is over 12 million euro, and compare that with the cost of running the MSc in digital health transformation of $500,000 a year. That's a significant return on investment. The other remarkable project that I would like to cite here is Gility and Mindinaro IMSHA, the interactive infrastructure map for the HSE, which was capable of locating every single network device and create a map of the ICT infrastructure of the HSE. That came in absolutely handy at the cyber attack because it allowed the identification of the devices, the tackling of the attack, and allowed a 3 times faster recovery from the impact of the cyber attack for the HSE, and not only that, but it allowed, with the resumption of care, the saving of uncountable lives. So the impact is really immeasurable. Next slide, please. What do the graduates of the MSc in Digital Health Transformation gain from it? Well, from the survey of the first cohort that completed the 18 months program, we can say that it is a springboard for graduates in digital health transformation. It creates the leaders for the Stay Left, Shift Left initiative. It enhances graduates' confidence and credibility. It has allowed them to secure new jobs and to advance their careers. It has enhanced the understanding of vital policies and procedures. It has enhanced the change management capabilities and also the potential for leadership in that area. And it has allowed for a sharing of best practice for the generation of new ideas. Furthermore, from the feedback of the survey, there have been vital ideas generated for the further development of the MSc in digital health transformation. For instance, by looking more at design thinking, at artificial intelligence, at data, cybersecurity, at person and community health. But also a network has been created through the alumni of that program who will stay connected, who will share their experiences, the new developments, and who also will be able to collaborate effectively across the sector and perhaps globally. And it has generated new ideas for projects. And now that the MSc in Digital Health Transformation has been also designed as a full online delivery, the roads are opened to move globally in the delivery of that program. And I think that will be a benefit in terms of communicating and sharing the experience gained in Ireland, but also of gaining international partners for collaboration in that vital area for development. Thank you very much.
President, and thank you, Kerstin. And Kerstin was pivotal in us delivering this programme here ahead of schedule. In the background, we have been working on some time compression technology, and we will look at that, see if we can use it after this. The network is really important, so what I suggest, let's take a 25-minute break for coffee. There's fabulous showcases outside, so we'll come back at 25 to 12. Thanks very much.